Nick York is one of the founders of the CLL Advocates Network and the past president. Currently, he is working for a British charity, Leukemia Care. As a CLL patient, he has in-depth insight into the needs of CLL patients. So my question logically would aim at that. Where do you see the main challenges of CLL patients at this moment?
I think there are two areas of need. You have to recognize when CLL is diagnosed, it's not diagnosed in the way that normal cancers are. You could look at the population of patients perhaps in 2/3. 1/3 of patients will present to their doctors without symptoms and will be diagnosed through a routine investigation, and they may never require treatment. Another third will present who are symptomatic, experiencing the challenges of living with that disease, and may require treatment at some time in the future, but will never know when. And then the final third will present requiring treatment pretty soon. So that presents a challenge of information giving. Information is required by CLL patients to properly cater to help them understand their own disease pathway and why they may not be treated straight away in the beginning, what they need to learn to understand their own condition, and to prepare them to be healthy for treatment and cope with what is called watch and wait. Watch and wait is the period used of active monitoring that clinicians use to manage patients who may need treatment in the future or may not, but patients don't know this. And the reason for this is that the treatments are often a lot worse than the disease during progression, and it could be like waking a sleepy tiger. You don't want to treat somebody too soon if they don't need it. And then the other area, so during that phase, there's a lot of emotional and psychological upset, stress, which is really debilitating. Stops people in their tracks. They hear the word leukemia. They may not need treatment for a lot of years, but they can't function. And it's not just the patient that's diagnosed, it's the family. And this needs some careful attention, and therefore information and education is key. Then there is the other act. So there's access to that, and working at CLL Advocates, bringing advocates together, we share how we go about providing information and support. Secondly, there's access to treatments. Now, there are effective treatments available, and it's an exciting time in CLL, but there is a variation across countries on how payers and appraisal bodies are accepting these treatments as appropriate or can afford them. Let's be fair, they're not cheap. So it's important that patient groups come together, leaders, and share experiences at an event like this, so we can show how the combined knowledge and the combined numbers can actually evidence the need of these drugs to make sure that patients actually get them when they need them and in the right order.